To start with my career journey off, I would trace back sort of the beginnings of my career to an internship that I did between my sophomore and junior summers. I actually had a family friend who did global health work. She had worked with Doctors Without Borders for many years. And at the time I was like, oh my gosh, I really want to work abroad. I'm studying global health. I just declared my major. Like, how can I work with her? Like, how can I learn from her? So my mom gave me her email and was like, go do your thing. So I set up time with her and she was willing to have me shadow her for a month. So it wasn't a formal internship. It was unpaid, but I spent 3 days a week with her in the office, learning about her day to day, understanding sort of what projects were in flight for her. And basically just getting a feel of like, is this something I'd be interested in? And that is what actually turned into the UN role. So when she was working that summer, it was actually 2 years before she came into this official UN capacity role and hired me. But she had just started to work on tuberculosis, which is the UN office that I was working in. The full title is the United Nations Office of the Special Envoy on Tuberculosis. So very wordy, but it basically means that the UN Secretary General appointed a doctor, Dr. Eric Gooseby, to be the special envoy on tuberculosis, which means that he was responsible for advocacy, for pushing research, for helping to align priorities with different world leaders on this disease. So I was very lucky that I sort of got a foot in the door during that internship. And then that the year I was graduating, 2018, was when the UN health topic that fall was tuberculosis. There was a high-level meeting on tuberculosis, which meant that that office was really in the spotlight and which meant that they needed some extra hands. So I stayed in touch with my internship contact. She and I actually still stay in touch with, which is awesome. But she approached me when we caught up and she said, hey, like, we're a really small team. We're all kind of like ramping up to this whole UN thing. And we could really use like just an extra set of hands and capable person to support on our projects. Like, would you be interested in working part-time? So this was fall of senior year. I worked through the spring part-time. So I was a part-time student. I took 3 classes, so I think 9 or 10 credits. And then I also worked 10 to 15 hours a week. And then following graduation, I transitioned into full-time for that summer. And I supported on making PowerPoint decks for different seminars that Dr. Gooseby, the special envoy himself, was presenting on. I supported my direct boss. So this woman, Jane, who I had done the internship with, she was the director of operations. So I supported her on letter writing and scheduling meetings. So very like more admin type things. I also supported on a lot of data analysis. And that was really what sparked my interest in data analytics, especially in the healthcare space. So a lot of what we were doing was trying to message to different countries, hey, your country is really doing not so well on drug-resistant tuberculosis. Like, you have a really high proportion of cases with drug resistance. This is something you should think about addressing. You should think about partnering with people during the high-level meeting. You should think about legislation. And so using data to inform the kind of messaging that we were sending out to different countries. Obviously, the high-level meeting came and went that fall, and I stayed on for a few more months supporting in some general research items, so continuing actually to specialize in that data analysis role. And some of that research got published, which was super exciting. Did not expect that at all, but I was like, amazing. I'm like 3 months out of school and I can add it to my resume. And from there, I had pretty much crystallized during that process. I loved working at the UN. It was super cool to be able to like walk in the building and be like, oh my gosh, like I read about this for 4 years and now I'm like, get to see it in action. But for me personally, it was so high level, it was a little bit overwhelming to understand impact. Like, I was like, we're telling these countries, like, please do this, but we have no idea if they're doing it. I personally don't know like how to track that. I don't have really like deep relationships, which is a lot of what advocacy is. So I decided that I really wanted to focus on the data piece, and that's what fueled my job search in the spring of 2019. So like 6 months after I had graduated. And that's when I ended up at Health First, which is a health insurance company in New York City. And I ended up on their population health analytics team. So what that provided me with was, one, the opportunity to grow my data skills. So I had self-taught Tableau, and I had done some coding in Stata for my, I think it was like my econ stats class. And I was like, all right, I'm writing this on my resume. Like, I'm going to leverage it. Like, I understand the basics of coding. Like, please take a chance on me. And they did. So I spent probably my first 3 to 6 months just like really getting up to speed on those technical skills. But I also was working on subject matter that was super interesting to me, which is population health. And a lot of the projects were trying to identify specific vulnerable parts of the population. So people who had multiple chronic diseases. So they were overweight, they had diabetes, and they had high blood pressure. And those are really, really tough people to reach. They have a lot of things going on medically. Often they had a lot of socioeconomic or social determinants also happening concurrently with those chronic diseases. And so doing analytics to understand who those populations were and where they lived was helpful in the insurance company being able to design better programs to support them. And then I also would do some follow-up analyses to say, hey, we piloted this program with 1,000 of these people. Like, did we see a change in their outcomes? Did they have lower blood sugar? Did they lose weight? Did they come to their doctor more often? So that was super interesting. I got a ton of experience with healthcare data, which is super messy. And I like remember the first day they showed me the claims tables. They were like, this is all the information, you know, what people get done by their doctor. And I was like, okay, cool. Like, what's that going to have? Like, it's going to have date, it's going to have the doctor, it's going to have like the code of like whatever disease they had. It was literally 300 columns wide. Like, there is so much data. And I was like, all right, this is quite humbling. Like, I have a lot to learn. But nothing like just getting your hands dirty to learn. So that's really what I did. And I ended up staying at Health First for almost 2 years. I ended up leaving because I felt like I had sort of hit a growth ceiling there. The analytics structure there was really, really large. It was a 70-person team. And so my role as an analyst was much more like intake the request, do the job, spit it back out. There wasn't a lot of like higher level thinking about what I really wanted to explore, or helping to shape the team and thinking about team processes and ways to be more efficient. It felt much more like sort of a cog in the machine, which was great for a while. And then I felt like I needed a new challenge. And that is when I started looking at the startup world. So what is the opposite of like a big, slow-moving health insurance company? A tiny startup where there aren't really a whole lot of rules and regulations. So I joined Stellar Health about a year ago. We were 40 people at the time when I joined, and we were Series A. So they had raised sort of one official round with investors, meaning like they got $10 million and made their pitch and whatnot. Now we're about 140 people, so over triple the size a year later. And last year we actually raised our Series B, so like the next funding round, where investors put up almost or more than $60 million. So it really does feel like an exponential curve, which is super exciting. Like, I don't know, I didn't really understand a whole lot about startups, but I was like, I mean, those numbers sound big, like that must be good. And then my day-to-day at Stellar is similar in some ways. I still work in an analytics capacity, so I'm working with internal stakeholders on our operations or sales or product team to think through what analytics would be helpful for them to make more data-driven decisions. But as a more senior member of the team, I'm also able to have a voice on our team processes, on what we spend our time on. I actually more and more have been able to advise the product team directly on how they should be building things. So when they're building, say, like, we want to make this new feature in our application where people can update the date themselves instead of automatically just defaulting to today's date, I will be in the room and talk through, all right, well, what are some of the data implications of that? Like, are we logging whether it's defaulted or whether it's user input. What does success look like? What are you actually trying to do with this? And are we able to measure it? So much more collaborative, many more people in the room, many more teams with different opinions that we all kind of have to come together and figure out the best way to move forward. And that's been super energizing to me to sort of go a level up from just like being on the screen typing away and actually thinking bigger picture about what we're trying to do. So I will stop there. That was quite the monologue.
That was great.
That is my career journey.
And it really is interesting to hear the different environments that you were in. And like you said, you found the perfect blend of kind of strategy versus, too hands-on or too lower level, I guess we'll call it for lack of a better word. But anyway, so that's great. And never underestimate the power of family members and social capital as well. And finding careers, sometimes I'll talk to students who almost feel ashamed or I don't want to ask, it's too easy, but definitely use that social capital. And if you don't have that, we have lots and lots of alums who are happy to talk to students and happy to talk with all of you on how to do that. So my last question is, what would you have done differently? Like knowing what you know now. So while you were at Georgetown, what would you have done differently?
I think one of the biggest things was my fear of wasting people's time. That was a big block for me in reaching out to people. And I think that applies to professors. So even now, if I'm looking at, if I wanted to go to grad school, I'm like, oh my God, like I'm going to need a professor recommendation. Like I don't have very many strong relationships with professors from Georgetown. I have a few. So like I have my people who I can call on, but I have friends who still keep in touch with professors in a really meaningful way. And they found people who were able to advise them on what it's like to be in the field or to help shape and say like, hey, like I did this, but from what you're saying, it doesn't really sound like that aligns with what you want. So I think using professors as a sounding board was kind of a missed opportunity for me because I was like, I don't know what I'm going to talk to them about in office hours. Like, I don't even want to deal with it. It's too stressful. And then the second piece was I often waited until I felt like I was like ready for a job search to kick it off. Like I was like, I need to like look at my resume for weeks. I need to like do a lot of research for weeks before I can talk to anyone because they don't want to be underprepared. But you're just never going to be fully prepared. Like it's never going to feel like I'm a master at this because you're not. And so every job search is going to be like partially trying to sell yourself and partially being really humble about what you don't know. And I wish I had leaned into the humility piece a little bit more because I think I would have been able to connect with people more quickly and more upfront and learn faster what I wanted to be involved in versus applying to like 3 jobs that I thought I was a perfect fit for and like only talking to people that I felt like I had good questions for. Basically, like, don't be afraid, cast a wide net is the advice that I wish I had followed at the time.
Great advice. Cast a wide net on campus and off campus. Yeah, I think, sometimes it doesn't feel as tangible when you talk to somebody too, and whether that might lead to something, whereas applying to that one job and then waiting, feels more tangible. So
yeah,
networking can be scary, but one-on-one, it can be a little bit safer. And there's so many alums and so many family members and friends that want to help you. Okay, great. Well, this has been fabulous. So let's open it up to questions, and feel free, you can put the questions in the chat, or you can raise your hand and we can call on you that way. So whatever you're more comfortable with.
Nicole, am I supposed to call on people? Go ahead, Nicole.
So my question is, what sorts of classes did you take and like clubs were you involved in during your time at Georgetown that you feel really prepared you either for like the population health aspect of your work or the data analytics aspect?
Yeah. So class-wise, population health, I actually think I took an epidemiology course, and that was, I think in the NHS. So I was in the SFS, but I was able to take that and it counted as my science credit. I think that was huge as just like a really foundational part of public health. Like so many people talk about epidemiology. It's obviously very relevant in today's day and age. And so I think like a couple of those grounding classes were super helpful. So that's, I would flag epi for the global health, public health aspect. For the technical piece, so fun fact, I actually registered for a computer science 1 class and I dropped it because I went in the first day and I was like, literally no way, like I can't do this. Like all these people were like talking, like, I don't know why I still think this, like a lot of like computer science terminology feels so random to me. They'd be like, oh, like I have like celery installed on my like Q drive 1. And I was like, I do not speak this language. Like I have to get out of here. So I didn't take any comp sci at all because I ran from it. But what did really help me with coding was actually my logic class. And I took this as a philosophy. And it was literally like foundational logic. So different symbols, like solving for proofs. So helpful because so much of coding is breaking things down and making them repeatable. And so having a really strong grounding, like of your mental framework for thinking about how to say like, if this, then that, and trace that through mentally, and then be able to translate that into code is like, I probably think about my logic class more than a lot of other classes I took at Georgetown. And then extracurricular wise, so I was in an a cappella group. I was in the Grace Notes all 4 years, which I loved. And I think the biggest thing I learned from that was like, take a chance and step into leadership positions. So when I was my junior fall and my senior fall, I was the president of the Grace Notes, which meant I planned DCAF, which is the DC A Cappella Festival. And that was like a huge undertaking. Like I was like, no problem, it's like going to be fine. A lot of work, like coordinating with vendors, ticket sales, managing schedules for the whole group, making sure we were on time for rehearsals. There actually was a leadership team. So there was a secretary, there were musical directors. So also like understanding how to delegate among a leadership group and like work together with people. I have a tendency to just like go heads down and do everything myself because it's like easier to just get it done. But I think some of those skills felt really real world translatable. Even though we were singing, we weren't like producing a official work product or paper. But taking on those leadership moments, or even just like if you're uncomfortable with something, volunteering to do it is a huge, like even small stretches, I think are really helpful.
Yeah, I think leadership experience always looks good too on a resume, not just in terms of being on the resume, but all the things that you can share about what you did and going in deep with student clubs versus, you know, joining 10 and not having much to say about them. Okay, so here's another question. What would you recommend for someone looking to start working in population health?
I think what's challenging to wrap one's head around, it certainly was challenging for me, is that pop health can show up in so many different sectors. So for example, when I was applying to jobs after the UN, I had like probably 3 or 4 different types of pop health jobs I was applying to. So one was like a nonprofit sector, like, oh, I'll be a program assistant. It's sort of more classic global population public health. The other one was pop health within a hospital system. So this was at New York Presbyterian, and it was a pop health strategy role. And hospitals have a totally different perspective on healthcare than other parts of the industry. One was the insurance job, which I ended up taking, which is its own perspective. And then the other one was at a startup. So basically, I think not limiting yourself to thinking about pop health as like one career track, but thinking about it as a theme that you can address from many different lenses was really helpful in unlocking that for me. I also think a lot of the more traditional pop health jobs that I saw seem to require an MPH, which was sort of frustrating. Like I was like, but it's like an entry level, like that's so unfair that you need grad school for that. So I would say basically like expect that and don't be discouraged by it. Feel free to apply. Some jobs are more flexible than others, but also definitely get creative about what pop health looks like, because there are places that have the support to take on someone who is truly entry level and you don't really need the MPH. But it can definitely be a little bit jarring when you're looking at job postings at first.
Great advice. And with that, you mentioned the MPH. So question, what are some of your thoughts regarding getting a master's degree? Do you see the value in that? Do you have any interest in that?
I have a lot of interest in it. I am having an exceptionally hard time deciding what is worth it for me. I'm sure that any master's degree will have some sort of value, but I'm definitely thinking about cost. So I'm thinking like, all right, if I went and did a 2-year program somewhere, that would be probably 2 years of not working and 2 years of paying tuition. And then I also think a lot about where do I want to be in 3 to 5 years career-wise, and do I need a master's degree to get there? And then doing the same exercise for like 10 to 15 years, what would be my dream job? And do I need a master's degree? I wouldn't say any of those exercises are giving me clarity, but I think I want to make sure that when I go back to grad school, I am really intentional about what I want that degree to do for me. Do I want it to help me pivot? Do I want it to help me get into a higher salary bracket? Do I want to move to a new place? And so I want to build a network in a new city and make sure I go to grad school there. Lots and lots of factors that I'm considering. I'm definitely pro grad school. I loved school. I want to go back to school at some point. I just can't quite figure out which ingredients to prioritize as I make that decision.
Totally makes sense. It's a good decision. So, question about just trends in the tech industry. So question specifically is about education. Like there's an article a student read about, employers not looking for education so much as the skill set. So curious to hear about what you believe, what your thoughts are on that trend and any other trends you want to share in the tech industry.
Yeah, I guess I can probably only speak to the health tech industry, health tech startup industry. I will say that a degree doesn't feel necessary. I think part of that is this nature of a startup where their growth is not as linear or as sort of like clear runged as it is in a really large firm. So for example, like my boss is a director and she has not been to grad school. In a more formal environment, some might say to be a director, to be a VP, you need an MBA or you need an MHA, Master's in Health Administration. I think in the world I'm living in, it sort of seems like all bets are off. Like there are people at a lot of different levels that don't have master's degrees. That being said, for certain people, and we actually had a recent panel among our leadership team, so our C-suite at my company, and it was a total mixed bag. Some of them were like, I would not give up grad school for the world. I think it gave me a ton of training. It gave me a great network of peers who were on similar tracks to sort of support me in my career journey. And some people were like, it just never really made sense for me, like financially or where I was career-wise or personally. I didn't swing it and I still ended up here. So I'd say trending, from what I understand about previous worlds, it does seem to be maybe trending a little bit away from those master's degrees. But if you get a master's degree and you find tremendous value in it, like there are ways to market that and still use that to get where you want to go. I've seen that happen in my company, so that's why I'm saying that with such authority. So I'll just say a little bit more about the different types of healthcare data and what that analysis actually looks like versus just, you know, the super broad term like health. So in my experience, I've analyzed, I think I would say like 3 types of data, very, very broadly. The first was sort of research focused data and analysis. So it was sort of statistics about a country, or, you know, tuberculosis incidence levels, or different government statistics about healthcare workers and density per population. So a lot of metrics that were already pre-produced, but I did additional analysis on them to support a specific research question related to global health or to tuberculosis. So that is sort of one category. And those were all like publicly available data sources. So you could go on the WHO website and download those yourself. The second type of data and the third type of data, I've sort of done a combination of at Stellar. Actually, I guess at Health First as well. So the second is basically like healthcare demographic and utilization data. So information on patients, who they are, where they live, their age, their sex, their ethnicity, as well as information about what kind of healthcare they're seeking. So all of their doctor's visits, all of their prescriptions, information about when they went to the hospital and what happened there. So basically like all the data around where and when they're seeking care. So I would call that, I guess, I'm calling it utilization and demographic data. That's sort of one, another section. And a lot of the analysis I did on that was identifying specific populations based on their patterns of care or on specific diseases that they had. And then the third type is actually analyzing application data. So Stellar Health is an app. It's an online platform that doctors use in their offices. And so there's a lot of data generated about the users who are actually going in and clicking around and completing things and logging in. And so that's not necessarily data about like a patient's health or diagnosis, but it's data coming from the application and giving us an indication of how it's being used. And when we combine that with the utilization data from the patient and where they're seeking care, we can start to understand the patterns and start to understand, you know, does X type of patient have more success when this app is also used in their care? So a little bit of combining those two in my current job as well. But those are the data sources. Does that help? I know those are pretty broad.
Yeah,